Interdisciplinary Fairy. I'm here to make sure that team process goes A-OK. Let's see what happens when the team meets today.
So where's Rebecca?
Yeah, guys, I have had the longest day. Not that you guys would know what that was like, because you guys don't work that hard. Can we make this quick? I'm super busy. What do you guys have to contribute to this meeting?
Ooh, that wasn't great. I wonder what kind of tools I have in here.
It's been a busy day. I know you all know how that is. I've set aside a good half hour for this meeting to discuss our patient, Sandra Bergen. Does anyone else have any time constraints that we should be aware of before starting this meeting? No. Okay. Great. So we'll just make sure that we know who everybody is here.
So my name's Emily and I'm Sandra's pharmacist. I'll be managing her medication.
Great. My name is Julie. I'm Sandra's occupational therapist and I'll be helping her with activities of daily living.
I'm Haley. I am Sandra's physical therapist and I'll be helping her with her mobility.
Great. I'm Elaine, Sandra's nurse, and I'll be doing her vital signs, her assessments, and giving her medications.
And I'm Sandra's doctor and I'll be managing her medications and I'm Rebecca. Great. Let's get started then. So Sandra Bergen is a 25-year-old female who was admitted early this morning. She was sustained a severe spinal cord injury about 2 weeks ago and is now paralyzed from the waist down. Today I would like to discuss our main focus for treatment and patient goals.
By the way, guys, Nura, the nurse, will be joining us later. She's just with the patient right now. So we all know how this goes, right? All paraplegic patients are the same. Physio, funding, psychological funk.
Ooh, poor Sandra. How do I have to fix this?
I took some time to talk with the patient before coming to this meeting, and I've already arranged a meeting with her to talk about her plan of care. So she used to be an active person, and she used to compete competitively in cross-country skiing. So now she's worried about changing her identity from an athlete to a paraplegic. Most of her friends she was connected to were connected through sport, so she's worried about being lonely and feeling left out. She's also very worried because she's so young about her future relationships and her sexual function.
Okay, but wait, what was the first concern we had for Sandra?
Can't remember. Not sure.
Ooh, somebody should really be taking some notes so nothing gets missed.
Okay, so I'm going to take some notes and just make sure that everything we've said in this meeting is recorded.
Perfect, thanks. And sorry for coming late, guys. My name is Nora. I'm the patient's nurse. I was just with her. Just looking over you guys' notes. Does anyone have any ideas how to tackle the management plan for Sandra?
Well, there has been some interesting research done in occupational therapy around counseling and other interventions that can help with her sexual functioning. So I can help with that. But my first concern would be to make sure that she's able to move around her house and the community safely and independently. She's going to have to be fit for a wheelchair and make sure that her house is accessible to wheelchair as well. She also is a very forward thinker, so we might want to talk to her about some of the baby steps that need to happen in her plan.
Wait, what time is it? I'm sorry, I gotta go. I gotta be somewhere.
Not so fast! Somebody should really be keeping track of the time.
So I'm just keeping an eye on the time, and we are progressing through the meeting well.
Thank you.
Thanks, Julie. And thank you for your ideas. Does anyone else have any ideas on how we can tackle Sandra's problem with her athletic identity and her love of sports?
I actually have some thoughts on that. So I'd like to focus on increasing Sandra's upper body strength so that she's able to move around in her wheelchair. I'd also like to make sure that she's moving as much as possible in her lower limbs as well so we can maintain her mobility there. But I'd mainly like to give her some information on parasport organizations once we're through with those things, and put her in touch with them if she's interested. So it would be really good for her to socialize and to maintain contact with the sports community. For my part in Sandra's care, I'm going to try to make sure that as much as possible she's not getting any overuse injuries from adapting to the wheelchair, And then it would be really nice if her pain medications were being timed with her physical therapy sessions. That way we can make that as easy as possible for her. So Emily, do you have any thoughts on that?
You know what, like, I'm not really into this. I have a lot of stuff going on. I don't have energy right now for this, so.
Ooh, the energy in there seems really low. Maybe we'll add some fairiness to liven things up.
Hang in there, Emily. You're doing an amazing job as reporter. Also, what does the child of a farmer and a pharmacy student have in common?
What?
They'll both be pharmacists when they grow up.
You always know how to cheer me up. Thank you. I feel a lot better now. So, in terms of her pain medication, you know what I'll do? I'll adjust her dosing just so she can take her pain meds right before her physiotherapy so she'll be pain-free during her sessions. How does that sound?
Sounds great. Thanks, Emily.
Thanks, Emily. So in terms of her medical management, things that I'm concerned about are the care of her bladder and just making sure that she's voiding properly and not getting any bladder infections. Maintaining upper body movement is really important for preventing kidney stones, but it sounds like you've got a handle on that, Haley, so thank you. Other things are making sure that her skin is staying intact and she's not developing any sort of pressure sores. For that, we need to make sure that she knows how to maintain a good hygiene and she needs to be moved when she's lying down. Do we know if the family's coming in to help her with transitioning back to home? Yeah. Okay. Nora, would you be able to take on the task of educating the family on what signs to look for with skin breakdown and what to do to prevent and treat skin breakdown?
Yes, for sure. I have time on Thursday to meet with Sandra and her family, so I'll definitely reach out.
Perfect. Okay, so the last major thing for me is the care of her bowels and making sure that her bowels are moving properly. So I'll prescribe some medications to make sure that that is taken care of. I'll write the orders today, but can you make sure that Sandra's clear on how to actually take the medications, Emily?
Absolutely, yeah.
Perfect.
Great, and just so everyone is aware, we have about 5 minutes left in our meeting. So should we make sure everybody has a clear idea of what everyone's roles are?
Yeah, for sure. Let me let you know what I wrote here. So according to my notes, it seems like the main goals for Sandra are making the transition back into her home and to her life as smooth as possible, helping her transition back into a sporting environment, and make sure that she has some education about her options and maintaining sexual function. For transitioning back home, Haley's going to work on her strength and mobility for upper body. Julie's making adjustments to her home. Rebecca's managing her bowels, bladder, and skin. Nora's going to educate Sandra and her family on how to take care of her skin at home. I'm going to make sure that Sandra's educated about how and when to take her medication, as well as monitoring for any possible adverse drug reactions. In terms of her sports participation, Haley again is going to get in touch with some parasport organizations and make sure that Sandra is staying strong and injury-free. And for her sexual function, Julia said that she has some good tools and interventions to address that and will work with Sandra on that. Finally, Elaine has said that she has scheduled time to meet with Sandra and answer any questions that she may have. Sounds good?
Yeah, for sure. And I think we should also make sure that social work is involved in this. In this case, like transitioning back into daily life for Sandra may be hard. It may be hard for her to find employment and to, like, just finance some of the things that she will need to get just in her daily life. I will make sure that I contact social work and fill them in on our plan for Sandra this far, and hopefully they'll be able to join us for our next session.
Okay, sounds like a plan. Bye, guys.
Wait. Should we debrief a little about our meeting? How will we improve next time?
Great idea, Nora. Here you go.
So from my perspective, it was key for all of us to take on our different team roles so that nothing got missed. There was clear intention for the meeting and we remained on time. Good job to our timekeeper. And we all maintained good energy. Thank you, Energizer. Throughout our meeting, I did notice, however, that the team didn't identify all the roles or like an organizational group for the meeting before the beginning. This made the meeting feel a little disorganized, don't you guys think, and inefficient. That made me worry that we might not be able to get through all the important
points. So in the future, I suggest that we identify all the key roles before starting the meeting. That way everything will go much smoother. How does everyone feel about that?
Great, thank
Sounds
you.
good. Yeah.
Just another day at work for the Interdisciplinary Fairy.